Hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and we are coming to you live from Bold Brave Media. I want to thank you so much for being here and being a proactive parent. This is about getting natural resources to help you on your road to recovery from autism with your child. And remember that the definition of recovery is to regain health. And this is everything that I do and what I share is based on the things that I used to recover my own son. And that was after I was told he would not recover. So like you, I was in a place where I felt that my son could recover, and I wanted to know what I could do for him. And I wanted it to be natural. I didn't want to drug him. I didn't want to have the side effects and the dangers, and I really wanted to find what the causes were of the problems. And so you're hearing more and more about autism being environmentally triggered, and what's happening is the biology of the body is basically getting messed up, and these kids are sick, and they need to get well. And that's what we want, is to make them feel better, be able to be happy, and live fulfilling lives. And today my son is doing that. He lives away on his own at college. He is completely over all of his symptoms of autism that he once had. And now it is my quest to share these resources with you. And I have created a free online workshop for you called The 4 Stages to Naturally Recover from the Symptoms of Autism. And that is to help explain things further and share with you what I can to get your child the optimum results. Stage 1 is healing the gut. Stage 2 is natural heavy metal detoxification. Stage 3 is clearing the co-infections, things like mold, Lyme, and strep. And then stage 4 is brain support and repair. And you can register for that free event going on right now at naturallyrecoveringautism.com/free workshop. No spaces, just free workshop. So I wanted to also, I'm curious if you have ever wondered why some children seem to really get better and other children maybe don't, and why your child might have even reached a plateau. And it has a lot to do with today's topic, which we are continuing our discussion, if you've listened in the past to a few of these, about the comorbid infections of autism. They can mimic the symptoms of autism and cause chronic inflammation in the body and basically not allow the biology to heal. So this is something that I found to be extremely important in my son's recovery and some effects that I have felt from it as well. Today we're going to be talking about one of the specific pieces of those comorbid infections. And so today we'll be furthering our discussion on mold biotoxins. So we are also going to go into natural treatment options for mold for both the person and the premises. It's very important to know that beyond treating the person, you've got to make sure that the premises or wherever the exposure is coming from is handled properly. And so we have Dr. Dashore, Dr. Jodie Dashore with us again today. Very fortunately, she is an expert in this field, a certified mold practitioner under the Shoemaker Protocol, and has developed herbal protocols of her own to treat this in a natural way, which is really important, so you don't get the side effects of things that really don't even work sometimes, and those antibiotic issues that they'll try to take care of these things with. I'm going to give you just a little bit of background on Dr. Dashore in case you have not been with us when she's been on with us before. And I have created a page at naturallyrecoveringautism.com/mold where you can get some of the resources we'll be talking about today, links to Dr. Dashore, and more information on mold and how to test will be on that site for you on that page. And also I have linked to other shows in the past that Dr. Dashore and I have done so that you can go back and listen to those if you like as well. Dr. Jodie Dashore is an internationally recognized pioneering clinician in the all-natural plant-based treatment of autism, Lyme's disease, mold biotoxin illness, PANS, PANDAS, nutrigenomics, and autoimmune illness. She works with children and adults in over 27 countries around the world, and Dr. Dashore is a board-certified doctor of occupational therapy, neurology, with a postdoctoral specialization in neurosensory. She is board-certified as a holistic health practitioner and board-certified certified in integrative pediatrics. Her past training abroad includes specialization in pediatric neurology and multiple naturopathic disciplines in Bombay, the UK, and the US. Dr. Dashore is currently pursuing her PhD and board certification in integrative medicine with a special interest in quantum physics. And Dr. Dashore is the founder and director of BioNexus Health Clinic in Marlborough, New Jersey, a center dedicated to plant-based and all-natural treatment methods. So, Dr. Dashore, thank you for being here. Welcome, and I appreciate you returning to share with our listeners.
Oh, it's a pleasure, Karen. Always a pleasure to be here.
So what we want to talk about today, again, is why don't we backtrack just a little bit for, there might be some who are tuning in about the mold biotoxin illness for the first time. And we want to give a little background maybe in the beginning on what is mold biotoxin illness, and then also how people can test for it before we move into the topic of today, which is more the natural treatment options available. So can you give a little bit of background for our listeners?
Yes, absolutely. Let's talk about what CIRS, or chronic inflammatory response syndrome, CIRS, is. It is pretty much exposure to water-damaged building that results in very high inflammation in multiple organ systems in the body. There are many autistic children in my practice. I would say over 60% of children that come to me have been exposed to a water-damaged building somewhere. It could be in therapy. As you and I both know, sometimes children go into these different therapies for a couple hours at a time. And like in our previous show, we had mentioned that I would like to go into that a little bit, that 25% of the general population, that is 1 in 4 people, this is not 1 in 4 autistic children. This is 1 in 4 of the general population, which obviously includes autistic children and autistic people, are genetically predisposed to their body not recognizing mycotoxins or mold toxins. So the immune system just never mounts a response. These toxins are not eliminated through the regular detoxification mechanisms in the body, and they can stay in the body forever, until they are systematically eliminated using the right medicines. Now, these children that come to me have, even after we treat them for the other comorbid symptoms that you speak about on your show, that I've spoken about, the PANS, the PANDAS, the Lyme disease, the Bartonella, the Babesia, and everything's been treated, and you still have the child that you feel as if, there isn't a full recovery from toxins has not been made, or there is something else going on underneath. And that is when it's a red flag for me, because it's important to understand all of the toxic factors that are making, the comorbid symptoms chronic. We need to recognize what mold illness is, and to make sure that we handle all the toxins in the child.
Okay, and that's great. We're going to take a short break right here, and when we come back, we'll go into what it is, what some of the symptoms to look for are, and then we'll move into our discussion also on how to test and how to treat naturally. So you're listening to Naturally Recovering Autism. Stay with us. We will be right back.
Have you ever wondered why some children recover from their symptoms of autism while others never seem to get any better? After 13 years of research, Karen Thomas has recovered her own son from his symptoms of autism naturally. She now shares how she did it with you in her free webinar so that you can have the right resources and knowledge to help your child. The definition of recovery is to regain health. Karen offers this to you in 4 stages: healing the gut, natural heavy metal detoxification, balancing the co-infections of autism, brain support, and repair. Register now for this free webinar to help you know what you can do to help your child to sleep better, be more calm, improve focus, and reach their fullest potential to live a happy, healthy life. Go to naturallyrecoveringautism.com/free workshop, empowering parents with the resources resources to naturally recover autism from a mom who's...
Hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and thank you for being with us today. We are continuing our discussion on the comorbid or the co-infections of autism and why your child might not be getting well and why they can plateau. And today's discussion is on one of those pieces of one comorbid infection, and this is on the mold biotoxin illness. And if you haven't heard some of the interviews I've done in the past with Dr. Dashore, I have linked to them on the page that was created for today's show at naturallyrecoveringautism.com/mold. So you'll be able to easily find those other resources if you'd like to go back and listen to those other shows that are now in the archives and still available for you. So Dr. Dashore, Dr. Jodie Dashore, is with us today. She is a specialist in this chronic inflammatory response syndrome or mold biotoxin illness. And before the break, Dr. Dashore, you were starting to just give maybe just a brief little bit of background to catch people up who might not have listened in on this before, and then we'll move into more specifics. Like it also might be good for them to understand, some symptoms to look for.
Yes, perfect. So let's continue with biotoxin illness. So as I mentioned in the previous segment about the approximately 25% of the population that are, genetically predisposed to having a very strong inflammatory response when exposed to water damaged buildings. Now, we're talking now coming back to autism and the trend that we've been following, with comorbid infections. Those infections like Lyme disease and strep bacteria, staph bacteria, mycoplasma, they produce endotoxins. Now, molds produce mycotoxins. So endotoxins and mycotoxins, studies show us that they act synergistically to elicit a cytokine-mediated inflammatory response. Cytokines are found in the body that greatly increase the inflammatory cytokines, greatly increase. I mean, it's pretty much a 0 to 60 response for those, the 25% of the population pretty quickly. The mycotoxins, the mold toxins most relevant to biotoxin illness are aflatoxins, ochratoxin, penicillium type mold toxins. We all know black mold is dangerous, but black mold is not the only mold. There are different species of mold that have been known to be very detrimental to the human immune system, to the human brain, and some of those are Aspergillus, Penicillium, Cladosporium. There is Wallemia, of course. There is Stachybotrys of black mold, and some of the toxins continuing about them are gliotoxins. Then there is one that is really toxic to the brain, which is known as trichosacine. Those are extremely toxic. They've even been used as biological warfare agents. Just to give you a brief, understanding as to how strong that particular toxin is. So when you combine these toxins with the microbial toxins, which are coming from Lyme disease, Bartonella, Babesia, strep, it becomes a pretty heavy-duty inflammation response in the body. And mycotoxins are absorbed through the respiratory mucosa, the gastrointestinal mucosa. They can be absorbed through the skin. They can be detected in the urine, in the gut mucosa, in the brain. Now, the indirect damage, often, not seen unless you do labs. It can be in the brain. It can be in the gut. They can, the mycotoxins can increase the insulin and leptin resistance, can increase the bad cholesterol or the LDL cholesterol. It can increase the clotting factors. And with children, with autistic children, you end up seeing things like, low IQ, lung infection diseases like asthma, chronic ongoing cough. You see reflux, gastritis, irritable bowel, leaky gut. You see that they bruise easily, poor growth, poor appetite, increased healing time after small illnesses. They rarely ever get fevers. The eyes have issues. There could be some visual motor issues. Conjunctivitis keeps happening over and over again. There seem to be issues with being able to see clearly, or the visual acuity keeps decreasing often. I had one child whose number, his eyeglasses, his number kept increasing every couple months. And he would go to, he was high functioning, so he was able to give us some information. The blackboard is blurry again. And mom was like, we just got you new glasses like 2 months ago. But that is all from mycotoxins. And we later found out that the new apartment that they had moved into in the city was water damage behind the walls. It was all done up. It looked beautiful. It was renovated. It was a co-op, which they paid an arm and a leg for, but it was in the basement. It was on the underground level, and they were happy because of the close proximity to the underground gym they had over there. But, it just kind of backfired on the family because this little boy had autism to begin with. But that is what happens with some of the symptoms that are seen with biotoxin illness after Lyme and co-infections have been treated.
This is something, too, it's important. Even when you're renting, there are some very simple tests that can be done it's basically kind of it's called a Hurts Me test. It's not that expensive. I mean, it's reasonable for what you get from it. There are a couple of different ones, but I have linked to it. It's at the bottom of the page at naturallyrecoveringautism.com/mold. And you can get that free download there to understand some of the testing options for homes, because you can through basically it's a kind of a swipe on a wall in a sense. If you're going to rent something, you're able to test it before you sign a contract or a lease. And same thing, testing schools, testing your home, testing grandma's house, etc. So we're going to take a brief break right here. You're listening to Naturally Recovering Autism, and we will be right back. When we come back, we'll talk further about some of these testing options and what you can do. Stay with us. We'll be right back. Hi, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and today we are talking about one of the co-infections of autism, the mold biotoxin issue. And this can be exposure from water-damaged buildings, and it can affect the brain, neurology, and be a reason why your child might not be getting better. Dr. Jodie Dashore is with us, and before the break, we were beginning to start talking a little bit about testing. So, Dr. Dashore, can you go into a little bit about how to not only test an individual, but also how to test the premises?
Yes. So, first of all, there needs to be very laborious history taking that is required along. It needs to be very in-depth. If there was any history of living in a water-damaged building, about the pregnancy, what is the age of the house, what building material is used, are there gutters, are there ice dams, just a few tips. And then you mentioned about doing a mycometrics test, or it's not necessarily from that specific lab. There are other labs which now run the Hurts Me or the ERMI. ERMI is Environmental Relative Moldiness Index. This test is becoming more and more recognized by the general mold testing people as well. In the environmental engineers is what they call themselves now. And many are aware of that test. And yes, it is advisable to run it everywhere, especially if you're seeing the kind of symptoms that I mentioned earlier. The type of HVAC system, because molds, certain type of brain and immune system toxic molds do grow in the HVAC ducts and the HVAC system itself, the body of the furnace. Many people have humidifiers attached to their furnaces, in the wintertime. Simple things like how quickly does the food get moldy if left out in the kitchen or dining room gives you some clue. Too many cardboard boxes in the house, musty smells, any travel, any exposure. Like I had a patient that went swimming in back rivers, and she was exposed to plankton and algae, and those can also cause a certain type of ramp up of the biotoxin illness. So if you see that your child was recovering okay, he was doing well, he or she, and suddenly there are some ongoing symptoms, once again, like fatigue, irritability, insomnia, memory loss, word finding difficulties, if the child is verbal, headaches, dizziness, increased head banging could be one clue, poor balance, whereas there weren't that many motor coordination issues before, gait abnormalities, tremors, clumsiness, muscle pain, abdominal pain, multiple food sensitivities, sore throat without any strep, nasal congestion, post-nasal drip, complaints of pain in the back of the throat, sometimes having those red veins in the eyes, complaining of swollen eyes, blurry eyes, nosebleeds. These are the kind of symptoms that can come from, it gives you a clue that there is a water damage issue going on. The labs to run is called as Dr. Shoemaker's panel, that is blood labs. Now, Dr. Shoemaker does not really recommend any kind of urine testing, but we know that drawing blood from autistic children can be a challenge many times. So Dr. Brewer is another physician. He's an infectious disease specialist from Kansas City who has, also like Dr. Shoemaker, has his own protocol for treating mold exposure. And what he does is he recommends using urine testing to detect what kind of mycotoxins are in the body. I kind of agree, because versus not getting anything, it's best to have some sort of testing, so at least we have a good background, because most parents would like to see what's going on in their child's body, and urine testing sometimes is the most feasible way for an autistic child to be tested. So a urine mycotox panel should be tested. I always test for additional toxins, like flame retardants and phthalates and toxins which come from plastics like BPA. So there are additional toxin tests which can be run. Again, they are urine tests. I also like to look at glyphosate, because remember, we are looking to address multiple toxins along with the biotoxin, because multiple toxins can bind together. And, we are not just looking for mycotoxins at this point, right? We are looking for biotoxins, because it's called as biotoxin illness. So it becomes important to eliminate all of these toxins that could be contributing to the high cytokines and high inflammation, especially brain inflammation in the body of a child.
Yeah, and this is really important too. Especially the glyphosate issue has risen, and it's getting more and more attention, which it should be. It's the dangerous herbicide Roundup. It contains glyphosate, and I was just at a home store 2 days ago, and it is just everywhere, and people don't realize the dangers of it. And you can even have problems with it if you're inhaling it through your nostrils. If you're out, it's sprayed in a lot of our food crops. And I have interviewed Dr. Stephanie Seneff, who is an MIT professor who specializes in the knowledge around glyphosate and how it can harm the physical body, and how important it is for you to know to really do your best to prevent exposure to it. So I will link to that interview as well, so that you can listen to that in the archives as well on the page that I created. Again, it's at naturallyrecoveringautism.com/mold. So I will add that to today's to the links on that page. Glyphosate is very important to know about, as is all of the other pesticides and the air pollution, and there's so much out there that the co-infections are extremely important to know about. But there's general other detoxification detoxification that needs to take place, including heavy metals as well, and then the glyphosate can affect the shikimate pathway, which is a pathway in the gut that it can contribute a lot to gut and digestive issues, as you see in children with autism. That is huge, and making sure that you know how to properly heal the gut, and that you're not doing more damage to the gut when you that you're unknowingly doing because some of the foods may contain it, or there might be current exposure, which again can happen around schools because they are spraying a lot of the Roundup around schools as well. So that's good to know, and there are some things that you can do about that at your school and awareness. We need to take a short break right here, so stay with us. You're listening to Naturally Recovering Autism, and we will be right back. Hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and we are coming to you live from Bold Brave Media and TuneIn Radio, and we are talking today about the mold biotoxin issue, one of the co-infections of autism that can prevent your child from getting well. And so we were talking a little bit before the break about some of the testing, and I do appreciate, Dr. Dashore, that you mentioned urine testing, because when I did the blood testing on my son, and at this point he was getting closer to being fully recovered, it was pretty traumatic. There was a lot of blood that was needed in that test, and I even felt bad that I was even asking him to do it. So I love that you brought up that urine testing has been accurate enough for you to be able to see enough of what you need to see. And I know there are a couple, maybe if you could tell us if there's a generalized urine test that can be used for all of these mycotoxins that will show it, or if there's one in particular you really like so people know what to get. And then I know there's a couple other tests as well that we wanted to just mention briefly. So I'll let you take off with that.
Oh, yeah, thank you, Karen. Yes, just wanted to remind folks that Dr. Shoemaker does not really agree with the urine testing, because his research shows us that mycotoxins in urine can be strongly impacted by diet. So, and I'll get into that, but the couple labs, right? There is real-time laboratories. Real-time laboratories evaluates families of the most common mycotoxins seen in urine. And again, it's a urine test. It's easily done, and its turnaround time is about a week. There is Great Plains Lab. Now, Great Plains Lab is a lab that runs other toxins as well that I mentioned. They have a general tox panel which looks at toxins that I mentioned earlier. It looks at the perchlorates, the benzenes, the flame retardants, the phthalates, and much more. They also have a glyphosate test. So pretty much you can give one urine sample and all three tests are done: the mycotoxin, the glyphosate, and the tox panel. Again, I have no personal affiliation with any of the labs. This is just information. So keeping in mind Dr. Shoemaker's testing, the lab results will be evaluated. So if you have a child who comes out very high with mycotoxins, like recently I had a mother, whose child came back with like in the thousands, and the range is anywhere from like 5 to 40. And this is thousands. Then that gives you a clue that there is, a huge dietary mold factor going on, and that was accurate because mom was, had been to another practitioner who told her that doing fermented foods is very beneficial for the gut. And I know that there is a certain point of view, that subscribes to that idea for children on the spectrum, and that's what she was doing. A lot of raw fermented food products for her son, trying to help him. But that's just the background. A couple of the tests. So here we go, right? Test your environment, test your urine if you want to. Dr. Shoemaker's blood panel is the best. Then we have a nasal swab for multiple antibiotic-resistant, coagulase-negative staph bacteria and biofilm that accumulates deeply within the sinuses of people exposed to mold. And the toxins can cross over the blood-brain barrier and cause a lot of inflammation and damage in the brain. It is important to also go on survivingmold.com, no other website, only survivingmold.com, and do the visual contrast sensitivity test, the VCS test, which is, for those children who are savvy on the computer, it is almost like a game. Do you see the squiggly lines or do you don't? So these are some of the tests that have to be run, and then you can come to a conclusion. What is the toxin load? What is the mycotoxin load? And what is the biotoxin load? How do you treat, Karen? So the first thing you do is you obviously remove the patient from ongoing toxin exposure. It could be home, work, school, car, therapy. There are air purifiers available. You need to clean up the diet. You can reduce the inflammatory cytokines. There are several herbal formulas which can be used to reduce the inflammation, the inflammatory cytokines in the brain, to reduce the inflammation in the brain and the gut. Gut healing comes into play. Removing these biological toxins from the body, that becomes important. So multiple toxin binders. There needs to be digestive and metabolic support because mycotoxins affect the hypothalamus and the melanocyte-stimulating hormone and vasoactive intestinal peptide. And these are very anti-inflammatory and very regulatory in the gut, like helping absorb nutrients, when you eat. And we know that many autistic children are picky eaters to begin with. One also needs to have a plan in place for accidental exposure because, you're investing time and money and resources into all of this. And then if there is accidental exposure and your child belongs to the 25% of the population, that is genetically predisposed, then the deterioration can be pretty rapid. So make sure that you have a accidental exposure plan in place with your practitioner. Some of the binders that are used is, the best binder is cholestyramine for children. We can use Welchol. These are conventional medicines. They do have a few severe gut side effects. Some children do tolerate in small amounts, but most autistic children find it difficult to tolerate things like cholestyramine and Welchol. So for those children, we have, there is a Luvol clay which comes from Europe that is has a very high affinity for absorbing mycotoxins. There is a special kind of activated charcoal. It's called as bioactive carbon charcoal or activated charcoal. This is a really great mycotoxin binder that I've seen. Often it is important to rotate. Maybe you have a child that can tolerate a pinch of cholestyramine or a little bit of Welchol once a day. And then for the rest of the day, you can do other binders like apple pectin or chlorella or activated charcoal or, different kinds of clays. Some families don't like using clays because they have heavy metals, and that is a whole other topic. But I've used clays, from really good sources very successfully in my practice. It's important to restore gastrointestinal vitality. So, humic minerals, microminerals, amino acids, aloe, glutamine, trace minerals are important, and avoiding all kinds of gluten, often avoiding amylose or, common starchy foods, vegetables that grow under the ground like potatoes and carrots. Those need to be avoided for a few months, and that greatly helps to bring inflammation down. There are specific probiotics like lactobacillus, et cetera, that can be used as well.
Great. And we'll continue this a little bit when we come back. We need to take a short break right here, but this is really important information. So you're listening to Naturally Recovering Autism. Stay with us. We will be right. Hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and thank you so much for being here today. We are talking about one of the very, very important co-infections of autism, one of the comorbid co-infections, and it is mold biotoxin, and the damage it can do to the brain, and that it can prevent your child from being able to recover recover from their symptoms of autism. And there are a lot more things to do. Before the break, we were talking about how important it is just in general, but also for the mold biotoxin issue. You still need to go through what I call the 4 stages to natural recovery. You've got to really heal the gut. You've got to have them on the right diet. You've got to get some good minerals, certain supplements in there that are going to help to benefit the body, and then remove some of the toxins as well. And I do want to share with you, I've got an online program. It's called the Autism Moms Mentor Program. In that, I utilize Dr. Dashore's herbal protocols, and that is something that we cover in the program, and it's important to have guidance. They're not available just outside of that program because it's very important to have guidance when using these, and know that you want to be certain that the system is supported with these binders, the correct gut healing, the correct supplements, the other things that are involved for the safest, best outcome, and to support the body while it's detoxifying. So if you're interested in that, on the page at naturallyrecoveringautism.com/mold, at the bottom there, you can see the resources that I do offer and learn more about them there. So Dr. Dashore, you were talking about, again, some of these really important things about certain foods that will contribute, and of course minerals are very important to get the right minerals in, and certain binders and gut healing work. So what else do you have to share around that for us today?
Yes, bile support and liver support is very important for detoxification, as many parents of autistic children might know, and that is no different for mold, for biotoxin illness and mold exposure. So digestive enzymes have to be regular, bile salts, motility agents like potassium, magnesium, to keep the bowel movements coming. Takasumi Supreme, microchitosan, these are some of the other names I can give you. Sometimes, glutathione is very helpful in increasing the antioxidants, supporting the mitochondria, having the adequate probiotics on board, having the beneficial yeast on board. Sometimes, having fibrinolytic enzymes like lumbrokinase, serrapeptidases, that really helps. And you mentioned earlier that other toxins like heavy metals, zeolites, xenoestrogens have to be detoxed. Very important nasal spray. Dr. Shoemaker's protocol has the BEG spray, which is an antibiotic nasal spray for the nasal bacteria, the MARCoNS we spoke about earlier. The autistic population, most parents, 99% of parents want to stay away from antibiotics for obvious reasons. So a couple of years ago, I came up and you mentioned, my proprietary herbal formulas, and that's one of them. It's Formula 1. It's the nasal spray. And again, with herbal formulas, you can dilute, you can start low and slow. There is no additional resistance that can develop. And Formula 1 contains the best of Western herbs along with the best of Ayurvedic herbs, along with a biofilm busting agent as well. And we're seeing phenomenal results across the world, actually. They're being utilized because there isn't a whole lot of local treatment that is available for biotoxin illness, and the awareness is really increasing. So that is about the treatment. There are certain essential oils that can be used as well. So I typically advocate nasal spray. I have a Formula 2 essential oil blend, which is a culmination of 4 years of research into a proprietary blend, which just really takes care of mold and viruses and bacteria in the environment. So you can run it in a diffuser, in a Epsom salt bath, detox bath. There are many ways of using that. And the third part, so Formula 1, 2, and 5. 5 is for dental health because again, over 70% of the children I see have dental issues because of MARCoNS, and research shows that MARCoNS will cause additional decay, especially if there is underlying Lyme and parasites. And I know you've done shows on those. One important thing I wanted to mention was about gut health. And I've had many children that have been diagnosed with the autism enteritis or autism gastritis, and have been treated conventionally with localized steroids and anti-inflammatories. Some have even done Humira, which is a biological that shuts down your immune system, and they've actually gotten worse. And that's because there is underlying mycotoxins and low MSH hormone levels that have gone undetected. So inflammation is flaming underneath. And even if you try to use heavy-duty medications like methotrexate has been used, that really hasn't helped these children. And so we have to look at immune modulation for these children that are severely gut compromised. And one of the most beneficial natural thing to use is camel milk. Camel milk, Karen, you and I are on and I'm one of the founding members for IFCAM, IFCAM. That is the International Forum for Camel Advocacy and Medicine. So that is where, we are building a public forum where patients and parents can interact with renowned camel milk experts from around the world, like Professor Reuben Yagil. We also have Dr. Scott McMahon, who is the number one mold biotoxin illness doctor on the planet right now. He's one of my mentors, and he's on board as well, and you are. And I think we can really educate people about the value of camel milk. Now, camel milk has it is very different from cow milk. It has immunoglobulins. It has there is no beta casein. There is no beta lactoglobulin. It helps with intestinal tissue repair, and we shall talk more in a minute, I guess.
Yeah, we need to take a short break right here. We're going to just touch back on this when we come back. You're listening to Naturally Recovering Autism. Please stay with us. We will be.
Have you ever wondered why some children recover from their symptoms of autism while others never seem to get any better? After 13 years of research, Karen Thomas has recovered her own son from his symptoms of autism naturally. She now shares how she did it with you in her free webinar so that you can have the right resources and knowledge to help your child. The definition of recovery is to regain health. Karen offers this to you in 4 stages: healing the gut, natural heavy metal detoxification, balancing the co-infections of autism, brain support, and repair. Register now for this free webinar to help you know what you can do to help your child to sleep better, be more calm, improve focus, and reach their fullest potential to live a happy, healthy life. Go to naturallyrecoverinautism.com/free workshop, empowering parents with the resources to naturally recover autism from a mom who's done it.
Hi there, welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and thank you so much for being here, being a proactive parent, getting the resources that you need for your children and the natural resources. Today we have been talking with Dr. Jodie Dashore on the mold biotoxin issue, which is one of the comorbid or co-infections of autism that can prevent your child from getting better if it's not treated properly and if you don't know about it, which a lot of people don't even know about it. We were talking also, Dr. Dashore, you were mentioning camel's milk, and I know there's a lot of curiosity around this, and I do want to mention that on April 16th, in a few weeks, Dr. Dashore will be coming back, and we will be doing our show around camel's milk because there is so much interest in this today that parents are wanting to know about. So very important that we will be. And in the month of April, I haven't shared yet, I will be coming. I thought that I was going to have the link for you today. It will be, if you subscribe on my website at naturallyrecoveringautism.com or if you've gotten the webinar, then I'll be able to send you the link to every day of the month of April for 30 days. I'm giving out a free resource every day with PDFs, video tutorials, checklists, various things that can help you with your child. So please make sure that you tune in for that. It'll also be released on my Facebook page at facebook.com/naturally recovering autism. So I just want to make sure I did tell you about that, and we'll talk more about that in next week's show as well. So Dr. Dashore, so that we're going to go further into camel's milk in the future, can you give information a little bit? I know we don't have much time left here for today, but it's very important that you touch on a few of the important aspects that people need to know about right off the bat with camel's milk, so people don't just go out and start loading up on it.
Correct. Yes, that is a very good point that you bring up, Karen, because, camel milk does have nano antibodies, nano immunoglobulins, and sometimes the effect can be similar to having an IVIG treatment or intravenous immunoglobulin treatment done, and it is not a good idea to load up on camel milk. The important aspect here to remember is that we are looking at for a very gentle immune modulatory effect. It has to be gentle, because mold will compromise your acquired immune system, and Lyme disease and other toxins molds will compromise your innate immune system, and the Lyme disease, comorbid infections, and other toxins will compromise your acquired immune system. So both the branches of your immune system are off track. So anything that modulates the immune system needs to be used under careful consideration. So I would really encourage your listeners to tune in on April 16th, where we will go in depth how camel milk, like just to give you an example, I've had to start, even with my own son, we had to start with 1 teaspoon and see how he responds. And then there's this whole other thing about raw milk and pasteurized and different kinds of pasteurization and, kids with FRA or folate receptor antibodies. So there is a lot of things to consider before just, going ahead and ordering, camel milk. And it's not cheap either. So you need to proceed wisely and well informed.
Right. Thank you very much for that. I know somebody said they wanted to start using it as a milk replacement, knowing that their child couldn't have cow's milk, and that's not the way to use it. You might even just have to start with something like a drop a day. So we'll be talking about that in the future. Thank you so much for being here with us today. We're out of time. As you can see, all this fabulous information, really important information, goes by really quick. There's so much to know. Thank you, Dr. Dashore, for being here with us today. Dr. Dashore's site is bionexushealth.com, and you can find the links to everything and things that we discussed today at naturallyrecoveringautism.com/mold. Have a great week. We'll